Doherty Caitlin Clark injury recalls cautionary tale. Idle thoughts while Caitlin Clark and WNBA TV ratings sit idle for the remainder of the WNBA season. You may be wondering how something so seemingly simple as a strained groin could keep a star player out for 2 months, and now longer. Clark injured her right groin during a game in Boston on July 15. On Thursday, Clark announced on social media that she would not be returning this season after playing in just 13 games. Consequently, I refer you back to 2022 and then White Sox shortstop Tim Anderson. On May 29 of that year, the leadoff hitter and his .356 batting average needed help to get off the field during a game with the Cubs due to a right groin strain. In the immediate aftermath, then general manager Rick Hahn warned that Anderson would be out at least 3 weeks, and that was how long he ended up being sidelined. At the time, Dr. Michael Nesek, an orthopedic surgeon with Powers Health Medical Group in Crown Point, Hobart, Cherville, and Valparaiso, had his suspicions about the prolonged prognosis. With a groin strain, he said, it depends if it is muscle or more tendon involved. If it is tendon, it takes longer due to the tendon having less blood supply. Nesek said that distinguishing between muscle and tendon is often as simple as palpating for tenderness, but sometimes requires the sophistication of an MRI, especially to determine the severity of the damage. Where is the tenderness? He asked. It must be pretty high, where tendon attaches the groin muscles to the pelvis, for them to be so cautious. If it is near the tendon insertion, I am sure they will do a PRP, platelet-rich plasma, injection to expedite recovery. Nesek warned strained groin tendons are difficult to manage. Still, they are hardly ever so severe that they need surgery unless the injury involves, additionally or instead, the nearby lower abdomen, and is then considered a sports hernia. Another differential diagnosis is impingement in the nearby hip joint, which will cause symptoms that mimic a groin strain, but often is responsive only after surgical intervention. FAI, femoral acetabular impingement, can translate into stress on the abductors, groin muscles, Nesek said. An isolated tear of an adductor tendon, however, is better left to resolve without an operation. It is unheard of, or rare, to do surgery on an adductor, he said. There is no evidence that doing surgery is any better than not. Any sort of surgery in that area does not seem to have a beneficial outcome. The greatest benefit comes from preventing the injury in the first place. Because once injured, the groin muscles and tendons are likely to be strained again and again. According to a literature review in the May/June 2010 issue of Sports Health, 32 to 44% of groin strains are tied to a previous injury. Anderson missed 10 days with a previous right groin strain in 2020. Clark had suffered a left groin strain in June that caused her to miss 4 games. Preseason conditioning should include exercises that increase the strength and flexibility of the groin muscles and the entire hip/abdominal area. One study cited in that same Sports Health article found that NHL players who later suffered groin strains had preseason groin strength that was 18% lower than those who completed the season without suffering the injury. To prevent re-injury, Clark should gradually maximize function about the hip joint before returning next season. The clinical milestone recommended in the Sports Health story is adduction strength, at least 90 to 100% of the abduction strength, and involved muscle strength equal to that of the contralateral, opposite, side. Groin or adductor muscles act to close and stabilize the legs together, and abductors act to bring them apart. Despite any best efforts by Clark, though, Anderson's injury offers a cautionary tale. In 2019, his .335 batting average was the highest in the American League. He hit over .300 in every succeeding season, even through 2022. However, after his eventual return in 2022, he was never the same. The .356 he posted pre-injury had eroded, also hampered by a hand injury, to .301 by season's end. In all, he played in only 79 games that year. He has never reached the .300 plateau again. After hitting .245 in 2023 over the course of 123 games, he was released by the White Sox. Last year, with the Marlins, he appeared in only 65 games, hitting .214, and was fortunate to latch on with the Angels via a minor league contract before this season started. He was elevated to the major league roster coming out of spring training, but hitting only .205 while playing in 31 games, he was released May 30. He has not played since, and his professional baseball career is apparently over at age 32. Without optimum strength and stabilization from healthy hip adductors, it seems a baseball player's fine-tuned swing is adversely affected. Meanwhile, in the time since Clark exited the Fever lineup, WNBA television ratings, according to multiple sources, have plummeted roughly 50%. Regardless of how well her rehabilitation goes, when Clark returns next year, the league will need to put a stop to the physical abuse Clark has received from opponents up until now. Otherwise, the injuries and the resultant public disinterest will continue.